say you're a nurse practitioner and maybe you work, like this is an actual example of somebody I do know. There's actually a nurse practitioner here in our area. It's a friend of ours, and she loves functional medicine. She loves stuff. She reads about it. Like she tries to implement it into her practice. So for somebody like that, what would be the best path that you could recommend for them to kind of participate in this? Is that something where maybe they could train with you and work with your company?
Yeah, absolutely. So I would say there's kind of a 3-tier path to that. So step number 1, which is going to be the cheapest and the easiest to implement, is to create a collaborative care practice. So that nurse practitioner, if she brings in a health coach who's trained in functional medicine, what's cool about health coaching is we are trained specifically in the science of behavior change. So she's reading all of these studies. She's learning about the nutrition. She's learning about supplements. She's learning about all these things, but she probably still doesn't necessarily have the skills to help someone actually eat differently on a Tuesday. And that's a huge gap that I see, a huge issue that I see in practitioners who are moving more in a functional medicine direction, is they can learn all the things, but the thing is their knowledge doesn't actually translate into their patients doing anything differently on a weekday when their kids are busy. And so the first easiest step is to bring someone in, like a health coach or a nutritionist or someone, to work in a collaborative care model so that patients get to see both. They get the expert approach, and then they also get the lifestyle support. And then that collaborative care model, when we work with someone else, when we work with another human, I'm teaching you something, you're teaching me something, I'm teaching you something, you're teaching me something. And so it accelerates that process of learning. So that's the easiest, lowest barrier to entry. Bring someone in. You don't have to hire a health coach full time. You can use an agency like mine, but get someone in your practice who can do this with you. So that's step 1. Step 2 is look into, the next level of certification. So Institute for Functional Medicine, anybody who already has a medical degree can go back and do a year-long course through Institute for Functional Medicine to learn all of functional medicine. And in that model, you're going to have, your professor is going to be Dr. Mark Hyman, and all of these founders and fathers of functional medicine. And again, one of the fastest ways to accelerate that, but still you're learning the knowledge. You're not learning necessarily the implementation. So step 1, hire a health coach. Step 2, go back to school. Step 3, start implementing things. Move from an insurance model to a cash pay model, because insurance doesn't cover functional medicine, which again is so maddening. Just to give you like a 2-second thing on why that's so maddening. We have a client who came to us 6 months ago with an A1C of 6.7. We worked with her for 6 months. She now has an A1C of 4.6. She paid us probably $500 total. And she's like, no longer a diabetic, but insurance won't cover that. Insurance will wait until you need insulin shots, and then will happily pay $2,000 a month for you to get insulin shots. It's just like, doesn't make any sense. But step 3 is to start to move your practice into a model where you're able to practice medicine in this way. And, talk about the removal of burnout rate. If you move from an insurance-based model to a cash pay model, you can spend as much time with your patient as you want. You can bill whatever you need. And we're starting to see the shift here in Colorado Springs. We have the Cash for Care network. And so we're a network of practitioners who, believe that we serve our patients better when we as the professional can look at that patient and decide what to do, instead of being told by a non-medical insurance company what I can do and what I can't do. So that's step 3, is to move your practice slowly but surely. You can still take insurance. You can still do some of those things, but start to create space where you can practice medicine that way. So, for a nurse practitioner who wants to get into that, number 1, get a partner in your practice. Get someone in there who you're not losing money from. If you hire a health coach through an agency model, you don't pay them unless you have a patient. So you're only adding to your profitability, but you're also creating that collaborative care model. Step 2, go learn, go back to school and get that information. And step 3, start the process of pivoting your practice so that you can practice that way more consistently.